Ketamine-assisted psychotherapy is a huge part of our practice at Flourish Mindset because it really provides this opportunity to expand your perspective beyond just your entrenched sort of default mode. Maybe you've done years of talk therapy and you're just not feeling a difference. What we're seeing ketamine be super beneficial for depression specifically, trauma, OCD, anxiety, and even for relational work, couples therapy, repair, especially around betrayals or other types of trauma. One of the characteristics of ketamine as a medicine is that it can help you to downregulate the response that your amygdala has in your brain. And your amygdala is like the fire alarm. So that's what's telling you something's wrong, it's dangerous. You can imagine when there's a fire alarm going off, it's pretty hard to slow down, be insightful about what's happening, unpack things, and feel safe to do so. So it creates this really safe space for you to look at your life experiences that were kind of causing blockages in your therapy. When you begin ketamine-assisted psychotherapy at Flourish Mindset, you're going to be paired with a therapist that's highly trained, and they work in collaboration with a healthcare provider. Then you'll have an intake session where we'll go in depth into your history, your goals, and really understand how ketamine-assisted psychotherapy can work for you. Then you'll have your first preparation session. So in this session, you're going to go over all the details, what to do beforehand and what to do after, and you're going to hone in on those intentions and those clear goals for your medicine sessions. Then you'll have your medicine session, typically between 2 and 3 hours. You'll be with your therapist that you've been working with. They'll be with you the whole time, as well as a medical professional to support you in your journey. It's a very internal focused process. So you'll have an eye mask with a specific playlist that's been curated for you and your goals. And then after you come out, we'll support you, we'll give you some tea, and we'll help you to kind of come back into the world with this new perspective and understand how you want to integrate what it is you've learned or experienced during that journey. We'll then schedule a follow-up integration session between 24 and 48 hours because there's this really juicy neuroplastic window that your brain has after you've had the ketamine medicine in your system, which helps with neuronal growth, meaning like you can create new pathways in your brain. You can think differently. And then we would repeat that process about 4 to 6 times, spaced about 1 to 3 weeks apart. But every person is different. So we really create a very tailored plan for you. I think the most exciting thing to me about ketamine-assisted psychotherapy is that we all have this inner healing intelligence, but there's sometimes just so many layers of conditioning and lack of safety that make it feel impossible to get down to. And rather than sort of white knuckling it, only having these basic talk therapy tools, now we can pair that with this medicine that has just such an incredible ability to give you a new perspective in such a short window of time.